It's April, folks. If you've been watching over the past few months, we've had a number of reports on organizations providing advocacy in our community. This month, we're celebrating occupational therapy awareness, and we're highlighting, with a very special report, a problem that has become common with our elderly: wrist fractures from a fall. For more on this and how occupational therapy is related to it all, we're sending it over to our Keiser University correspondent, Jorge Castillo. Jorge? Thank you for sending it over. Like you were saying, today we're going to talk about how fractures can affect our daily lives and how specifically occupational therapy can help. Now, there are many types of wrist fractures, and each one is unique, depending on the person, the damage done by the fracture, and a number of other factors. Medically speaking, the type of fracture we're going to be discussing today are referred to as distal radius fractures, or DRF, since that's a bit of a mouthful. We're going to be focusing on the elderly population with this report, but be aware that this kind of injury can happen at any age, from kids to teenagers to adults. DRFs are a fancy way of saying wrist fractures. In this case, they mostly happen when you fall onto an outstretched hand. Imagine, for example, you're walking around the park, your dog on a leash, everything going well. Suddenly, a squirrel. Your dog goes ballistic. Your hand almost gets ripped off. You tumble to the ground before you can stop yourself, and at the very last minute, you throw your hands out to stop yourself from hitting the ground. All the same, you land on the ground, and all of a sudden, pain is pretty much all you know in life. As we get older, our bones become more likely to break. If you fall and your bones are already weak or brittle, you might end up with a fracture. For women, the risk of these fractures doubles every 10 years by the time they reach 50. Medical treatments are available, and they include surgery and splinting, with most patients requiring a combination of the two. It's a fact of life, we're all getting older. Try as we might, and we certainly try our best, you can't delay the passing of time, which means that sooner or eventually later, you're going to age, and the many problems that are associated with that will also appear. Knowing about DRFs now can help you be more prepared in the future, in case it happens to you or a loved one. Mary is a 68-year-old retired widow living alone in a 2-bedroom apartment after her husband passed away from COVID last year. She has 2 grandchildren, a 2-year-old boy and a 10-year-old girl. Since she retired, Mary has taken up gardening, she has enjoyed exercising with her friends at the park, and she practices yoga on the weekends. Recently, during a walk with her girlfriends, Mary tripped and fell onto her right hand. Feeling some pain and tenderness, she went to the hospital where she was diagnosed with a DRF and given a splint to mobilize the arm. After the injury, Mary started having trouble doing the things she used to do before at home. She couldn't dress herself very well, she couldn't babysit her grandchildren because she felt like she couldn't take care of them very well with her arm like that. She feels afraid of falling and hurting herself again, so she's not going out with friends, she's not exercising outside, and she stopped taking yoga and cooking classes. She can no longer do her gardening and housework without needing help or complaining of pain, which is making her depressed and anxious about her future. For someone like Mary, occupational therapy may be able to help. Occupational therapy, like the name says, is in the business of occupations. If you do something because it's meaningful to you, that's an occupation. Getting dressed in the morning and sitting down to eat a meal you prepare are all examples of occupations. When you're not able to do these things anymore, occupational therapy is there to help you figure out a way out. In Mary's case, she explained all her current problems and how they were affecting her daily life, and the occupational therapist began working with her on an evidence-based plan that would help her. He gave her recommendations for dressing, like techniques to save energy and to be safe when getting dressed so as to prevent re-injury. Mary was able to address her fears of taking care of her grandchildren after the injury as well. She felt weak and limited in what she could do. She didn't feel like she could cook for them, help clean up, or put them to sleep. The OT provided activity simulations, like using a stuffed pillow to simulate carrying her grandson around, and easy meals she could do with one hand. Mary found that she was actually able to carry around far longer than she thought on her unaffected side, which made her very happy. She said after that, she could kind of figure out the rest. For her physical activity, the therapist suggested that Mary teach him the yoga exercises she was doing in the group to suggest improvements to her posture and to allow her to be more comfortable with the process once again, especially around other people. She was hesitant at first, but she felt good about being able to do her exercises at home without anyone looking at her and felt like she could eventually take a step back from that.
We hope you've enjoyed this very special report. By helping Mary regain her independence, occupational therapy proved how essential it can be at making someone's life better. Whether it's preparing a meal, getting in the car to drive up to the store, or taking care of your little ones, if you have a problem, occupational therapy can help. As we said at the start, April is OT Awareness Month, so we hope that this report has helped you understand why we need occupational therapy and the many ways that it can help you live a better and more independent life.